Today's lesson is called Vitamin D and Fibroids, a ray of hope for women's health. We'll explore what fibroids are, why vitamin D has attracted scientific interest, and what women should realistically take away from the evidence. Welcome to our channel, Learning with AJ7. Grab a seat and let's learn together for a few minutes. If you or someone you love has ever dealt with heavy periods, pelvic pressure, pain, or fertility concerns, this topic matters. Fibroids are common, but common does not mean simple. Today we'll separate hope from hype and focus on information you can use. By the end, you'll understand how fibroids develop, what vitamin D does in the body, why researchers are investigating a possible connection, what the limitations are, and which practical next steps are worth discussing with a healthcare professional. This is education, not a diagnosis or a substitute for personal medical care. Uterine fibroids are growths that develop from the muscle tissue of the uterus. They are usually non-cancerous and they can vary in size, number, and location. Some people have no symptoms at all. Others experience heavy or prolonged bleeding, cramping, pelvic fullness, frequent urination, pain during sex, or challenges related to pregnancy. The experience is different for every person. Location helps explain symptoms. A fibroid that bulges toward the uterine cavity may affect bleeding more directly. One within the uterine wall may enlarge the uterus and contribute to pressure or cramping. A growth toward the outside may press on nearby organs. Imaging, often an ultrasound, helps a clinician understand what is happening. It is also important not to assume that every symptom is caused by fibroids. Heavy bleeding can have several explanations, including hormonal changes, adenomyosis, polyps, bleeding disorders, or other conditions. Severe pain, sudden changes, dizziness, or bleeding that affects daily life deserve medical attention. A careful evaluation is more useful than guessing from a single symptom. Vitamin D is best known for supporting bone health, but it also participates in immune regulation, cell growth, and tissue signaling. That broader role is one reason scientists are studying whether vitamin D status may be connected with fibroid biology. The key word is may. A biological connection is not the same as proof that a supplement will shrink an existing fibroid. Some observational studies have reported that people with lower vitamin D levels may be more likely to have fibroids, or may have larger or more numerous fibroids. Laboratory research has also explored how vitamin D-related pathways could influence the behavior of fibroid cells. These findings are interesting, but they do not establish a simple cause and effect relationship. Think of medical evidence as a ladder. Laboratory studies can reveal possible mechanisms, observational studies can identify patterns, clinical trials can test whether an intervention actually changes outcomes, guidelines then weigh the full body of evidence, including benefits, risks, and alternatives. Vitamin D and fibroids remain an active research question, not a settled cure. Researchers have proposed several possible mechanisms. Vitamin D may influence signals involved in cell multiplication, tissue remodeling, inflammation, and fibrosis. Fibroids are hormone-responsive growths, so scientists are interested in how these pathways interact with estrogen, progesterone, and local tissue conditions. But proposed mechanisms are hypotheses to test, not promises about what will happen in one person. This simplified illustration shows why the question is scientifically plausible. Cells respond to chemical signals, and those signals can affect growth and tissue structure. Vitamin D-related signaling is one pathway among many. Genetics, hormones, age, body composition, inflammation, and other health factors may also play roles, which is why no single nutrient explains every fibroid experience. Here is the responsible reset. Vitamin D may be relevant to fibroid research, but it should not be presented as a guaranteed treatment. Do not stop prescribed therapy, delay evaluation, or take high-dose supplements based on a social media claim. If you suspect deficiency or have fibroid symptoms, a clinician can help decide whether testing or treatment makes sense for you. If this lesson is helping you understand the topic more clearly, please like, comment, share, and subscribe to our channel, Learning with AJ7. Your support helps us create more practical, trustworthy learning content for women's health. A vitamin D blood test can answer a different question from an ultrasound. The blood test looks at vitamin D status. Imaging looks at the uterus and the fibroids themselves. One does not replace the other. Your clinician may also consider symptoms, bleeding patterns, medications, pregnancy goals, bone health, and other conditions before recommending a plan. A productive appointment can begin with practical questions. Ask what may be causing your symptoms, whether vitamin D testing is appropriate, whether supplementation is safe with your medications and health history, and which fibroid treatments fit your goals. Shared decision-making matters because symptom severity, fertility plans, fibroid location, and personal preferences all influence care. More is not automatically better. High-dose vitamin D can be harmful, especially when taken without guidance or combined with other supplements. Products can vary in strength, and individual needs can differ. Follow advice from a qualified clinician, read labels carefully, and tell your healthcare team about every supplement you use. Food, sunlight habits, medications, and medical conditions all belong in the conversation. Fibroid care can include watchful monitoring when symptoms are mild, medicines that target bleeding or pain, treatments that address hormone pathways, minimally invasive procedures, or surgery in selected situations. The best choice depends on the person, not just the scan. Vitamin D research may eventually add another piece to the puzzle, but it does not replace established care. While researchers continue studying vitamin D, broader health habits still matter. Regular movement, nourishing food, restorative sleep, stress support, and keeping recommended appointments can support overall well-being. These habits should be framed as supportive, not as a promise to prevent or cure fibroids. Compassion is important too, because symptoms can affect work, relationships, confidence, and quality of life. Seek prompt medical care for very heavy bleeding, faintness, severe dizziness, sudden intense pain, shortness of breath, or symptoms that rapidly worsen. These signs should not be managed by experimenting with supplements. If you are pregnant, trying to become pregnant, or have another medical condition, seek individualized advice before starting or changing any treatment. Let's summarize the important lesson. Fibroids are common, usually non-cancerous uterine growths, but their symptoms and impact vary widely. Vitamin D is being studied because it may influence cellular and tissue pathways connected with fibroid biology. Current research is promising enough to continue investigating, but not strong enough to call vitamin D a guaranteed cure. Testing and treatment decisions should be personalized with a clinician. The key takeaways are simple. Know your symptoms and get an appropriate evaluation. Separate encouraging research from proven treatment. Avoid unsupervised high-dose supplements. And discuss your options with a qualified clinician who understands your health history and goals. Knowledge does not replace care, but it can help you ask better questions and make more informed decisions. Thank you for learning with us today. Please like, comment, share, and subscribe to our channel, Learning with AJ7. If you know someone who may benefit from this balanced overview, share it thoughtfully and encourage them to speak with a qualified healthcare professional. Keep learning, keep asking questions, and take care of your health. Please like, comment, share, and subscribe to our channel, Learning with AJ7. We'll see you in the next lesson.